Hello and welcome to another enriching episode of MedSynapse podcast series. I'm your host Hetvi Shah, and today we are diving into an often overlooked yet life-threatening condition, which is pulmonary arterial hypertension or PAH. PAH is notorious for being underdiagnosed, often masquerading as other respiratory or cardiac conditions. Early detection and precise management can significantly improve patient outcomes. And to guide us through this complex topic today, we have an esteemed expert with us, Dr. Rajdeep Dhandhokiya. Dr. Rajdeep is a highly experienced pulmonologist based in Ahmedabad with expertise in all respiratory disorders. He has more than a decade of experience in pulmonology, including clinical research and academic. He's dedicated to ensuring a holistic treatment experience for individuals suffering from pulmonary conditions. So, welcome, Doctor, to MedSynapse podcast series, and it is a honor to have you with us today.
Thank you very much, Hetvi, for inviting interesting topic and yet untouched topic for most of the common people. So I am
Yeah.
really happy that I have a chance to explain this complex topic to the audience.
Thank you. I'm so excited to hear your thoughts on this topic today, Doctor. So, to start with, Doctor, we know that PH is so underdiagnosed or misdiagnosed also, so leading to delays in treatment. So, from your experience, what are the most common clinical red flags that should alert physician to suspect PH early?
Okay. Actually, I really wish pulmonary artery hypertension is just like systemic hypertension, so it can be diagnosed with a very simple method like sphygmomanometer, by which we can diagnose systemic hypertension, but it is not so. So most of the time it is misdiagnosed. So early, we should suspect EH, particularly in the patients of WHO subclass group 2 and group 3 and group 4 as well, because they are the majority chunk of these PH cases. So in such cases, when there's a particularly in my subject, I'm a pulmonologist, so I face majority of patients of respiratory diseases. So in PH patient, there are multiple symptoms which are all up with other diseases as well. But yet we can suspect when there are underlying secondary conditions like obstructive or restrictive lung diseases like COPD, asthma, then interstitial lung diseases, and in case of cardiac condition like valvular heart disease or other heart failure with preserve or reduced ejection fraction. So in such cases, we have some close by symptoms that we can earlier suspect the PH, like dyspnea, most common symptom. So we can correlate with PH in such cases. Otherwise, like a headache, then peripheral edemas, so then blotting of abdomen, indigestion. These are the some symptoms which can lead us to suspect the PH.
Yes, I think that's very insightful. Also, Dr. Since you mentioned that PH symptoms overlap with other conditions like cardiopulmonary also. So, do you think that routine checkups should be more aggressively used in especially high risk patients?
Definitely. But for screening purpose, we have very limited tools. But yet they are very much helpful in case of moderate to severe cases. Like 6 minute walk test, we can measure desaturation of a patient. Then echocardiography, again it is non-invasive. ECG, which is less sensitive but more specific. So we can also run screening ECG, which will be economical as well. So these are the some tools we can use and utilize to early diagnosis of PH in case of high risk patients.
So now, Doctor, once a patient is suspected or diagnosed with PH, risk stratification plays a crucial role in guiding treatment. So, what are the key tools clinicians use to assess PH severity and determine the best therapeutic approach?
Right now, I'm practicing in India and Ahmedabad. So, and likewise, in most of the developing nation, most common tool is 2D echocardiography.
Hmm.
Even though it is in
Although,
comparison to other diagnostic modality like right heart catheterization, it is less sensitive, but it is the most common tool and most
hmm.
helpful tool we can use to diagnose the PH. And other is DLCO. It is also pretty much helpful to diagnose the PH. So in this way of diagnosis, we will require help of cardiologists. So they are pretty much helping hand in diagnosis of PH.
Actually, it's fascinating to know, and I think multidisciplinary approach is something that everybody should look forward to. So now, Dr. PAH treatment has evolved significantly, and emerging therapies like gene therapy and precision medicine are creating new possibilities. So, could you highlight on some of the most promising advancements and ongoing trials that clinicians should keep an eye on?
Uh, Definitely. Uh, there are few molecules which are readily available into the market,
Hmm.
but it was very confusing whether they are helpful or not. But after so much clinical experience and trials as well, there are molecules which can be helpful in class 1 and class 3 and 4. So such molecules are prostaglandin, prostacyclin analogs, then PDE inhibitors. These are the molecules which are readily available and can be utilized. On advanced molecules, you have talked about precision and genetic molecules. So they are very in primary stage of trials. So it will take many years before
Hmm.
we can try out on the patients. So right now, initially, if I talk about this PD inhibitors, sildenafil and tadalafil, in case of PH associated with COPD. So in
Hmm.
initial year, there was thoughts that they will worsen the symptoms of patient. But by years of clinical trials and clinical experience, it is now come out that they will help to reduce pH and that will not worsen the symptom. So pretty much common molecule, but pretty much helpful. Such other things are prostacyclin analogs as well, which can be used IV, oral, or inhaled molecule, and can be used in uh, with safety as well in every class of pH.
Yeah, I think that is so exciting to hear about new advancements. Now, Doctor, managing PAH effectively often requires collaboration, as you also mentioned earlier, that pulmonologists have to collaborate with cardiologists. Including pulmonologists, cardiologists, and even rheumatologists sometimes. So, in your opinion, how can this multidisciplinary approach improve patient outcomes?
In a multidisciplinary approach, I would like to say that we can divide this portion in three parts, like preventive.
Hmm.
So in this case, likewise, pulmonologists, rheumatologists are also involved in case of diagnosis of connective tissue disorder, let's say. So connective tissue disorders are themselves causing class 1 PH, but when they involve lung parenchyma that cause ILDs, so if they are also proactive in diagnosing ILD and initiate the treatment at early stage, then we can prevent the development of PH, or at least we can slow down the development of PH.
Correct.
In case of management, yes, cardiologists will always needed for pulmonologists to diagnose the PH. Uh, Even if we learn how to do 2D echo, but there is a most gold standard investigation tool, which is right heart catheterization, which is out of scope for pulmonologists. The cardiologists are 100% needed in such diagnostic tool. So definitely, and after the diagnosis, and when patient reach to advanced stage of PH and converted into core pulmonary. So in such cases, there will be important role of psychologist as well, physiotherapist as well for rehabilitation, then transplant physician and transplant surgeon as well, because at the end of the day, when there is a irreversible changes in the form of core pulmonary, only 100% gold standard treatment is lung transplant or bridging treatment. So in that case, transplant physician, transplant surgeon uh, will have a role.
Yeah, actually, that's a great perspective, and I think multidisciplinary teams helps in from pre-treatment to the post-treatment. So it's really important for every PH patient at least. So now, doctor, from a pulmonologist perspective, what advancement do we need to improve PH survival rates and overall quality for patients?
Being a pulmonologist, I would like to see that some easier tool and more sensitive and more specific towards diagnosis of pH will required. Likewise, I talked initially for systemic hypertension, there is a sphygmomanometer, very easily available, very cost effective, we can diagnose easily. Such kind of tool is required to diagnose pH as well, and awareness among general physician. So I think this is the requirement of the need of the time that we uh, earlier we find out such tools, better we have outcomes.
Yeah, that's rightly mentioned, doctor. So, doctor, before we wrap up, one last question is like, if there's any one key message you would like to give to physicians about PH, so what would that be?
I will like to suggest them that keep eye on X-rays, serial X-rays, because many a time X-rays are also important tool in case of pulmonary artery enlargement. We can notice in case of at least respiratory patients, there will be enlargement of pulmonary trunks uh, and pulmonary artery on chest X-ray. We can see that. Other is ECG, like there can be right axis deviation, then poor airway progression, and many physicians also do 2D echo as well. So most of the time their focus is on left-sided heart and miss the right side. So I will request that also keep eye on the right side. So we can early diagnose because most of the echo are also performed by physician. So these are the and the clinical symptoms most important like worsening of dyspnea, development of peripheral edema, rising jugular venous pressure, then tender hepatomegaly, congestive signs, and on blood reports worsening of pro-BNP level. So then congestive reports like a rise in SGPT level. So these are the investigation which can be helpful,
Yeah.
and I would like to suggest them that keep eye on those reports.
Yeah, I think that's a powerful takeaway, and I think early diagnosis is something that every physician should look out for, and it's really important to always keep reminding them. So, yes, that's really interesting to know. So, Doctor, this has been a truly insightful discussion, and your expertise in pulmonology and pH management was really invaluable to us. So, thank you so much for sharing that today with us.
Thank you very much. Thank you, Ati.
Thank you. And I'm sure our listeners have gained important clinical insights today. And to our listeners, thank you for tuning into this episode. And remember, if you're a healthcare professional who's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay informed and keep making a difference.